In a bold move that has captured public attention, Bernie Sanders is calling for Robert F. Kennedy Jr., the health secretary appointed by Donald Trump, to resign. This demand comes amid escalating concerns regarding the state of health agencies in the United States, which have recently been thrown into disarray. In a compelling op-ed published in the New York Times, Sanders expressed his grave concerns about Kennedy's impact on public health, stating that he is endangering the health of the American people now and into the future. He emphatically declared he must resign. Sanders criticized the Trump administration's repeated claims of wanting to make America healthy again, a slogan he agrees with in principle. However, he pointed out that the actions taken by President Trump and Kennedy since they took office have been counterproductive to this goal. One of the most alarming developments, highlighted by Sanders, was the recent dismissal of Susan Monarez, the director of the Centers for Disease Control and Prevention, CDC, along with the resignation of 4 other senior officials who left in protest. These officials were reportedly unhappy with Monarez's refusal to endorse Kennedy's controversial policies, which they deemed dangerous. Sanders further elaborated on Kennedy's long-standing opposition to vaccines and his promotion of conspiracy theories that have been widely discredited by the scientific community. He noted, despite the overwhelming opposition of the medical community, Secretary Kennedy has continued his long-standing crusade against vaccines and his advocacy of conspiracy theories that have been rejected repeatedly by scientific experts. He pointed out the absurdity of Kennedy's claims, such as his assertion that there's no vaccine that is safe and effective. Sanders questioned the credibility of those who support Kennedy's views, mentioning that one of his primary sources for claims about vaccines and autism had his medical license revoked and his research retracted from a medical journal. Sanders accused Kennedy of profiting from and building a career on fostering distrust in vaccines. He warned that as the head of the Department of Health and Human Services, Kennedy is now wielding his authority to wage a war against science, public health, and the truth itself. Highlighting the flaws in the current healthcare system, Sanders expressed concern that Kennedy's ongoing attacks on vaccines and scientific evidence would hinder Americans' access to life-saving immunizations. He pointed out that the Trump administration has already made it more difficult for many healthy young adults and children to receive COVID-19 vaccines, forcing them to navigate a convoluted healthcare system that often results in higher out-of-pocket expenses. A senator cautioned that Kennedy might soon target the childhood immunization schedule, which includes essential vaccines that protect children from serious diseases like measles, chickenpox, and polio. The danger here is that diseases that have been virtually wiped out because of safe and effective vaccines will resurface and cause enormous harm, Sanders warned. In recent days, the Trump administration has faced unusual bipartisan criticism following the firing of Monarez, which coincided with significant budget cuts to the CDC and rising concerns about political interference in health matters. Meanwhile, Kennedy has continued to make dubious health claims, drawing sharp rebukes from experts and lawmakers alike. Since taking charge of the health department, he has dismissed health agency staff and entertained various conspiracy theories. Recently, over 750 current and former employees of U.S. health agencies signed a letter denouncing Kennedy as an existential threat to public health. These health workers accused Kennedy of complicity in dismantling the nation's public health infrastructure and jeopardizing the health of Americans by spreading misleading health information. This letter was released in the wake of a tragic shooting incident at the CDC headquarters in Atlanta, where a gunman, influenced by misinformation about the COVID-19 vaccine, opened fire, resulting in the death of a police officer and the gunman himself. The shooter had been struggling with mental health issues and believed the vaccine was harming him, according to his father. As the debate continues, one must ask, is Kennedy's approach to public health truly beneficial, or is it a dangerous gamble that could have dire consequences for the American populace. What are your thoughts on this contentious issue? Do you agree with Sanders' call for resignation, or do you believe Kennedy's views have merit? Share your opinions in the comments.